Today I'm showing a case of interesting dementia case. It is a 66-year-old lady with history of bizarre behavior and memory impairment. Previous several studies has been canceled due to claustrophobia or pain. Finally got a study. I find bilateral temporal atrophy, mostly in the anterior aspect of the temporal lobes. Worse on the left side, which is the patient's dominant side. The temporal pole is most affected. The posterior aspect of the temporal lobe are relatively preserved. So the hippocampus is preserved posteriorly, and the anterior atrophy, and then amygdala is atrophic. The frontal lobe is not bad, but this is a case of classical semantic dementia. This is another case from the literature. The literature basically is a very early semantic dementia with a progressive temporal lobe atrophy over 8-year study. Again, 62-year-old, that is a age lady. Another case of early elderly lady. And this is over 8 years. You can see the progression of the atrophy of the temporal lobe, dominant hemisphere, anterior tip over time. Just over time, there's more atrophic. It's hard to diagnose this early and hard to treat. So it is belong to the group of frontotemporal lobar degeneration. Semantic dementia is under this group, and then this is also a one type of neurodegenerative disease. This is an overall category of this lesion. And another case of the semantic dementia, just like our case, asymmetrical left side, anterior temporal, preferential involvement. So I'll just show you this case.